Grüezi ragazzi, willkommen and bienvenue to Cannabis Sciences LinkedIn Live for this week. For those of you that are joining us live, thank you for being here with us today. And for those of you who will be checking out the recording at a later time, also a big thank you to you. We hope you enjoy it and that perhaps you leave this session today having learned something new. Cannabis Scientia aims is to combat the bottlenecks of medical cannabis industry using the power of education and through the training of healthcare professionals on the effective use of cannabinoid medicine. And in doing so, we believe that that's one of the best way actually to increase access to medical cannabis for patients worldwide. Now, on the screen, you should be able to see an overview of our services, as well as a QR code that you can scan so you can get in touch with us. And this is something that we are really, really excited about. Soon we will be launching our Principle of Clinical Cannabinology Handbook. It's really literally around the corner. If for those of you joining us in Cannabis Europa in London on the 2nd of May, please note this on your schedule and come visit us because we will be launching this book. And so amongst other things, as you can imagine, this book covers from the physiology of the endocannabinoid system to clinical practices, but also regulatory landscapes and the products that are available in the different jurisdictions. So, of course, if you're interested in learning more about the handbook, please reserve your copy. You can do so by scanning the QR code. And one of the exciting things of today's session that, of course, we will be talking about kids, cannabis, and autism. But joining us today in today's session actually is Dr. Mauro Cardoso Lins, who is a physician with many, many years of cannabis therapy under his belt and a very valued contributor to our upcoming Principle of Clinical Cannabinology Handbook. So thank you very much, because we believe that not only science should have been communicated through this book, but also the real world evidence of doctors. So you gave us the opportunity to be able to do that. So thank you very much. And I actually would like to directly pass the word to you, Mauro, and just let us know, introduce yourself so that also other people can understand who you are and all the amazing things that you're doing. Thank you.
Okay, thank you. It's good afternoon here in Rio de Janeiro, Brazil. I guess it's got almost good evening in Italy and everywhere else. I really don't know. So my name is Mauro Lins. I'm a pediatric neurologist. I've been working into pediatric for 32 years now. And I've been working with cannabis, CBD, cannabidiol for children, especially children with autism spectrum disorders, for almost 10 years now. So it's some nice experience with children and teenagers that I have been seeing for years, using cannabidiol, different dosages, different approaches. And I would like to share my experience with you. And thank you, Viola. Thank you, Fabio. Thank you for the kind invitation. It's always a pleasure. And I hope we can have some nice interaction and valuable information.
Thank you. And also I would like to introduce Fabio Turco, for those of you, Dr. Fabio Turco, for those of you who already don't know him, very bad. It means you haven't been around here enough, but I'll introduce you to our Chief Scientific Officer. He will conduce today's session a bit more to get in the juices of what we want to learn today. And so I know that many of the people that are here are familiar with the concept of ASD and the use of, for example, CBD in ASD, but we would like to kind of set a scenario. So first of all, thank you, Fabio, for joining us. I'll just pass you the mic, and perhaps you want to start ahead, because I know these sessions are always like super quick. So perhaps you want to kind of jump into it with Mauro directly.
Yeah, thank you, Viola. Good afternoon and welcome everyone to this LinkedIn session. It's really a great pleasure for us to have to interview Dr. Mauro Lins, who also contributed to our handbook Principle of Clinical Cannabinology, sharing with us interesting case studies on children with autism treated with CBD. So in this live session, we will discuss the lateral perspective on the use of CBD in the management of autism. We hope that this discussion will shed light on a very pressing issue in the medical field today, and maybe it can help doctors and families with autistic individuals make informed decisions about their treatment option. So, Dr. Lin, welcome again. And in recent years, there has been an increasing interest in using cannabinoids, especially cannabidiol, as a treatment for autism. What is your opinion on this approach?
It's a very interesting opinion. So, autism, by the time I was in my medical training as a pediatric neurologist, 1994 and 1995, the prevalence was 1 for 500 children. And now the current prevalence just released is 1 for 36 children. So it's a lot of patients, a lot of families, it's a lot of people involved. We don't have many options, pharmacologically speaking. We have the antipsychotics that are authorized and have been used for a while, and other kinds of drugs into psychopharmacology with different profiles and side effects. So cannabidiol, CBD, is a very welcome addition to this group of pharmacological treatments, let's say. We have also psychological treatments and other approaches. And it has been my best experience so far using pharmacology for children and teenagers on the spectrum. I have had very impressive results so far that I haven't achieved with other drugs or a combination of drugs. It's not a miracle drug, doesn't work for everyone, but I have had very impressive results with a minimum side effect profile. I monitor patients with blood panels regularly, and also when needed gastrointestinal studies as well for those that come previously with gastrointestinal situations and complaints, and the results have been great.
So how does cannabidiol compare to the more traditional treatment for autism, both the pharmacological and the psychological approaches?
Yeah, so the psychological approaches, they will have to be adopted and they will have to be carried out and continued until the therapists release the child or the teenager from the treatment. So they are, like for most of the children, the cornerstone, the basics of the treatment. But some of these children and teenagers, they are so dysregulated that they cannot comply with the treatment. So that the therapists cannot get to them, cannot interact, cannot promote results, because some children seem to be completely disconnected, as they are in their own world. They are not interacting with the environment. Sometimes they are more aggressive, they are more restless, and for these particular complaints, irritability, aggressive behavior, being like connected, I have had better results with CBD than with traditional typical drugs. And sometimes the results are so impressive and they're so fast. That's why people sometimes call it miraculous. But unfortunately, it doesn't happen for all the patients. The answer is clear. It's a spectrum. It's a spectrum disorder. So we have from one end to the other end. Maybe we are treating symptoms. I don't know if we are treating the core causes, the root causes, because it's a different population. So many genes involved, more than 168, 170 genes already confirmed to be involved. So it's always a different profile, but we have similar symptoms and we have similar conditions. For some of these patients, because I contact families very often, so we interact through WhatsApp and those similar apps. And I always ask them to report 5 days after initial use, then 10 days, 20 days, depending on the case. So we have very nice interactions. And sometimes the first report, 5 days, 7 days, it's really impressive for families sending like videos of their beloved child doing things that have never done before, being more attentive, and sometimes even promoting communication. I think that as the child regulates, becomes more with the environment, more connected to people, not to things, the families can report those unbelievable progress sometimes. But unfortunately, remember, doesn't work like that for everyone. But at the end of the day, even for those that don't have impressive results, we don't have bad side effects. I never had really to, I don't know if it's the topic now, but to stop cannabidiol from a patient because of serious side effects, not psychological and not also like organic or gastrointestinal. I know it's a common complaint, but we never had to stop, and I never had any major alterations in hepatic enzymes and things like that in the blood profile.
Okay, this is very impressive, really, what you say. Yeah, moreover, we know that, as you say, autism is a spectrum disorder, so very usually we don't know the cause of the pathology. We also don't know why CBD have this effect, because we know that there is limited research regarding the mechanism of action of CBD in autism. There are some studies that we know that suggest that CBD may interact with the endocannabinoid system, which is involved in regulating, for example, mood, appetite, and the pain in the brain. We know that CBD may regulate serotonin levels, which are also connected with mood and the social behavior, which may be altered in individuals with autism. CBD may also reduce the inflammation, the oxidative stress, and the excitotoxicity of the brain, all factors involved in autism. Moreover, we know that CBD can modulate the immune system. So maybe all these mechanisms together can explain the effect that we see with CBD. But moreover, you were saying that there are very few side effects, but can you tell us more about this side effect? They are in all cases limited, or there are sometimes side effects that are so hard that you have to stop the therapy?
Mm-hmm. So stopping the therapy, we never had to do that. So all patients are doing fine because we monitor the blood levels, or whatever we can monitor related to possible side effects, and it's been really fine. Now, as to like psychological or other effects, we didn't really have to stop the treatment, but some patients, they have different responses. For sometimes some children, maybe with very low dosages initially and increasing dosages very gradually, they have what we call activation. They become more irritable. They become more agitated. They become more, moving one side to the other. So they become agitated. We call that activation. It happens with other drugs as well, right? With some antidepressants, the SSRIs. And also, although it's very used for sleep issues, every time you come across CBD, there's something about insomnia that it may help. But for some children, and I really don't know why, it doesn't help sleep, and also it creates insomnia for some very few patients. But I have that, the mother comes to me. We started the dose at night because I thought it would help sleep, and now we have insomnia. He's not sleeping or she's not sleeping well. Then we win the dose, or we pass the dose for like just morning and early afternoon, and that issue is resolved. So it's very confusing because it's on spectrum, but mechanism, as you cited, there are many mechanisms involved, not one that can fully explain. It happens in other conditions with cannabinoids as well. But one thing is for sure, I know it helps, right? So now we have enough material to look for mechanisms, because one thing is clear for me, it helps. It's not placebo effect. I've been on the road for 32 years. It's not a patient that I just recruited, for an experiment or for a project, for a research project, that I have never seen the patient. So I came across that patient during screening for my project, and then I carry on and I evaluated the patient for 2 or 3 months. No, it's patients that have been taking care for 5, sometimes 8, 10 years, and then CBD became an option now. So I can clearly see the changes. It's not a placebo. It's not that I'm influenced, or neither the family is, because some of the families, they have suffered so much that it's really a relief. And they are very happy to share the videos, and they have reports from school, they have reports from therapists. It's kind of impossible that everyone else at the same time is influenced by some placebo effects. It doesn't make much sense to me, right? So in terms of side effects, insomnia eventually in that activation eventually as well. Now things like nausea and stomach ache, I know they happen, but they are not really reported to me. It just as an addition, I really don't know which patients will respond that well, right? But I have seen that some patients with really genetic conditions, diagnosed syndromes, sometimes they don't respond really well, right? I have a patient now, she's 8 years old. She's very, very aggressive, not only physically, but verbally. When she's in the office at the reception, if an adult passes or a child, she'll try to reach and slap or kick or offend. And she has been taking antipsychotics, antidepressants, and anti-epileptic drugs, trying to modulate her behavior. We started with CBD. Now she's on 300 milligrams per day, and it seems just like water, no response at all, right? Now, for children that have an inflammatory background and children with GI issues, which in my practice and also in the literature are the most common comorbidities, it seems that it responds better. I haven't defined it about that. I have to gather more data from the patients, from my records, but they seem to respond better, especially when they have those GI issues, esophagitis and gastritis, sometimes even eosinophilic esophagitis, which is a complicated condition that now we see more and more often than we used to see in the past. So these will be the better respondents for me.
Oh, this is very interesting because it will be really great to have something that can discriminate in advance which patients can respond to the treatment or who cannot respond to the treatment. Moreover, as you say, very important thing that is that CBD works. Maybe there can be some issues, as you say, because we know that CBD have a biphasic effect. So maybe this can explain why in some patients it induces insomnia, in other patients it induces sleeps. It is in literature this biphasic effect, but the fact that it works is very important. But this is in contrast of what we see in literature, because we know from you, from other medical doctors, from literature, that there are a lot of single case studies who say that CBD works very well. But when it comes with the clinical trials, especially randomized, controlled randomized clinical trials, it seems that it does not work. But we know that this is a problem maybe on the approach, because for randomized clinical trials, there are issues that cannot be solved with the cannabidiol, but also with the cannabis product. So according to you, why there is this discrepancy between big clinical trials and single case studies?
Yeah. So when you have a practice like me, like I have seen patients, I have been talking to friends, you become very enthusiastic about CBD. When you go to the literature, I'm getting more enthusiastic, because years ago it was kind of hard, as you said, because the clinical trials do not match what we see in the office most of the times. Reasons are the clinical trials themselves, the way they are planned, the way people can do them, because it's hard to perform a perfect dream clinical trial that you can follow patients properly for more time than short times that I see, 2, even 6 months. Some children will show benefits later on that road, right? When they become more regulated, maybe less inflamed, and they respond better to therapy. And also depends on the criteria you are using to evaluate. What are the end goals of your study? What are you observing in the results? What are you trying to show or to prove? Then we have different kinds of products. When a trial, okay, you don't have that problem, right? In a trial, it will be the same product, and then, but what kind of product? What's the protocol? And especially, who are those patients, right? So, are they homogeneous? Do they have, what do they have in common, and what do they do not have in common, right? You may in a trial you could have the patients that I say that don't respond. Maybe we get most of those patients and very few of the patients that would respond. But otherwise, in the selection, you could get the patients that respond very well and very few of those, because it's a spectrum, right? We are not addressing really the cause. We are addressing symptoms. But what symptoms? What is the end goal of the symptoms? A very good results for aggressive behavior. I don't have good results for hyperactivity. As I see people talking, I also see in the literature for TD, ATG, attention deficit, hyperactive disorder. I don't have very good results that in autistic patients that show that behavior. I don't use that as a first line option for patients with only attention deficit disorder, right? So, but clinical trials, they will be more elaborated. They will become better, maybe with a better time frame, right? And using better methods to evaluate responses. And we'll get there. It's just a matter of time and patience.
Totally. It just came to my mind, for example, that in the evolution of trials for cannabis-based products for MS, that actually at some point, for example, the scale of Ashworth scale for measuring spasticity was evaluated as not a good scale. So it was dropped down, because if you were just looking at that type of evaluation, actually cannabis-based products were looking like not effective for MS, when in fact it's really, really effective. So, and especially in the type of spectrum disorders that we see, like autism, for example, often it's also a matter of understanding how to use a good scale that can evaluate subjective quality of life and what's the change. So of course, as clearly Dr. Mauro Cardoso was just saying now, I get directly, the WhatsApp message from the family, maybe that they are showing me a video of the type of new interaction or the new thing that is happening in our family that for us is huge, but how do you testify that in a clinical trial? And this has also been the driver, if you will, for the choice for our new publication to include, of course, all the literature with what comes from clinical trials, but then also really taking, the time to really go and look for doctors like Dr. Cardoso, because this job is like what's happening in the background, but it's life of hundreds of people, so it does have a relevance. And I sorry if I entered in here. It's just to remind you that we don't have a lot of time actually before we end the session. But I also got like a sciencey question that it came to my mind while the doctor was actually explaining how he sees this correlation between autism and GI issues, which I find very interesting, because of course we are seeing usually endocannabinoid system disbalances having these insomnia issues, GI issues, perhaps pain and mood disorders, so they usually are connected. I was wondering whether in your practice you tend to use as well like a kind of union of products, and so perhaps also together with CBD, maybe like a probiotic or something that works in the direction of also like the lifestyle or the nutraceutic, because I find it here in this live as well came other doctors, and I see that also them work in a pretty holistic manner. So I was wondering whether that's something that is extended in different areas, and how that does that work in terms of protocol, if it's something fixed or if it's something that you see there are some better responders for these or some other people that just doesn't make sense.
Okay, so GI issues, those gastrointestinal issues, they are really important. They are no exaggeration. They are not a trend. They don't belong to a a group of scientists or doctors that like that. It's real, right? We have the literature, we have the science, and we have us doctors here at the front, right? I'm sitting at my desk. It's nobody now. It's lunchtime, but we see that a lot. And unfortunately, many physicians still neglect that. They say, no, it's autism. Everything is autism, right? So sometimes the child is really irritable, agitated, she's not really fine. Oh, this is autism. No, most of the times this is not autism. This is something else causing that symptom. And I have a partner here that I refer patients to her. I believe now we have over maybe 50 or 60 children with endoscopies, right? And showing eosinophilic esophagitis and gastritis and kinds of issues that when we start treatment with drugs and diets, they become much better. And cannabidiol is part of the process also. I also use vitamins and supplements. I love probiotics. I use probiotics for those children. Sometimes I also use PEA, right? Palmitoil etalolamide, we say here in Portuguese. And sometimes also I have impressive results that the family will get back to me a few days later. Oh, that last substance we started and he's better now. He's not complaining so much. He's not so, his mood is not that heavy anymore. He's happier again. So we never know, but it helps. In GI issues in autism, they have to be considered most of the times when the child is not regulated. So in those clinical trials, also depends on selection criteria, right? So if in your selection criteria you have a child that is not really well because it's in pain, right? Or has a profound psychological maladjustment at home, it's not suitable for a trial, right? So this morning I had a family here that they asked about cannabidiol. Years ago, when I mentioned cannabis, they would almost run off out of the office. Okay, it's trying to give drugs to my child. No, now they ask. I don't have to talk. I don't have to raise it anymore, right? And oh, how about cannabidiol? I said it's not the proper time. A lot of disadjustments at home, fights at home. Mom and dad are separating, so it's chaos. So it's not the proper time. They need psychological assistance. They need another approach, not a drug. So cannabidiol or any other drug will not give results because they have to work psychologically what is happening in the house. So selection criteria for studies should consider what child or teenager are we selecting, right?
Yeah, I guess autism's like everything else, but in particular has a very strong component of what's the environment at home, especially in your development years. And I guess also something like cannabis, even though it's CBD, is not psychotomimetic, it does. We need to take in consideration certain setting of where that's been taken. So perhaps sometimes it's, as you said, doesn't even matter to have the magic pill if everything else is in the middle of a war. Perhaps we need to look at decreasing that amount of stress before we even start with any therapy in that sense. And it makes a lot of sense, actually. Sorry for my intrusion. Fabio, if you had like a
No,
last question
great.
to ask.
Yeah,
I know
yeah,
you talked about PA. We are big fans of PA. I never heard actually of using it for autism, so this is very exciting.
Yeah, I use for some children. The fact is you have to start with very low dosage. I have friends that started for like 9-year-old, 6-year-old, 600 milligrams per day, divided in two doses, and the reports were not good. More agitated. Sometimes I started at 100 milligrams per day and asked family to report later on. It's not isolated, right? I use other things, but in my protocol of vitamins and supplements, generally I add one thing at a time, right? It's like you conquered a territory, now you try to conquer another one. If you start too many things at a time, so I'm too
it's a
old
mess.
to organize that because it won't work and you will never know what's working, what's not working. So that's why I'm clear that sometimes the only thing I changed was PEA and it helped. For the patients, it's like just like water, nothing. So the problem is which patients will respond.
Okay, thank you, Mauro. I have just one last question about the product. Which kind of CBD you use? The pure CBD, the extract, or the
Yeah,
what do you
yeah.
use usually?
For several reasons beyond the scope of our talk today, I only use it in the beginning for most of my patients, a pure isolated CBD. Now, for some patients, I use also what we call the broad spectrum. So it's a THC, no THC product, because I learned with families, right, that some children would not respond well with very aggressive behavior to isolated CBD only, but they responded much better, totally different to a broad spectrum product.
Okay, thank you very much, Dr. Linz. It has been a really interesting talk. Maybe we need to address some other points in another interview, and so we hope to see you again with us.
Yeah, I'd love to share and interact again. Thank you for the invitation. It was very nice.
Always a pleasure listening to you. Actually, I think we just scratched the surface of this topic that is pretty immense,
Yeah.
but our time is over. And actually, I think, as usual, I managed in first person to learn a lot already. So I hope, hopefully, other people that were online did learn something from this too. And of course, if you have any questions, we are gonna also leave. Are we allowed to leave maybe your email address for anyone that maybe want to get in touch with you, Dr.
Yeah, that's okay. All right.
Okay.
So
So we will
first
do
of all,
that.
it's a lot of work here. I don't promise fast responses, right?
Of
I
Because
course.
yeah,
we
it's a
we're
lot of
hearing the
work.
numbers of patients that you're treating at the moment and are quite impressive. So yes, thank you for all you're doing, and also to take a little bit of time to update us on how you do it, which is really, really interesting. And of course, as always, fruit of years of trial, test, and error, and checking out how it goes. And this is so precious because it's giving us the summary, basically, of so many of these experiences. So thanks again. And we'll meet up again next Tuesday, actually, with another of these live, with another amazing doctor from the other side of the ocean. So I really look forward to meet any of you here. Thank you.
Thank you.
Goodbye, everyone.
Goodbye.